All right, we are gonna move on to her chin, so stay tuned. All right, we are back with Alex in the chair, and this time we are giving her some chin filler. Her chin was slightly deficient, and adding some filler there is going to really kind of change the shape of her face, change the shadowing a bit, and really make everything kind of come together. So I'm using Juvederm Voluma here, heavy filler, higher G prime, to really add some volume there. You can see that I did mark the patient. I marked from nasal ala down and kind of marked my safe zone, and then I'm isolating kind of where I want to place that product. I'm using 2 hands to aspirate before every injection, and that's AAFE safe injection technique. You can see that my needle is kind of deep down in there, and that is because I'm placing that product on her bone, aspirating prior to each injection, and then giving little boluses of product. I'm kind of reevaluating after each injection to make sure I like it. And then once I'm about done, we will kind of see what it looks like and start slightly just, manipulating it just a tiny, tiny bit to kind of mold it how we want it. Patient's handling this procedure well, wincing just slightly, but she's not numb, so she's really, really doing great. Here we are. So we have done this patient's lips a couple times in the past. The patient loves them. We are using a medium filler here to kind of just plump them up. This patient gets really dry, cracked lips, and she experiences some cracking in the corners of her mouth in the cold months. So that is really a therapeutic reason as to why we placed filler in her lips in the first place. But of course, cosmetically, she loves the appearance as well. Here you can see me placing just a little bit of product using a back-filled Comfort Tox syringe and really laying tiny little amounts of product to kind of perfect and enhance her Cupid's bow, which is the look she's looking for. You can see how beautifully that's coming out already, really kind of crisping up those borders and providing the patient with exactly what she wants. Now we're moving on to using the syringe that the product came with, and I'm just going to add some general volume to the body of her lips. You can see here that I'm kind of holding the skin taut and doing a little fanning technique to save the patient a poke. I have gauze nearby always. Sometimes patients decide to bleed a little bit. Her lips have been numbed with topical numbing, so she's doing great. It's a little pinchy for the patient, but she's handling it really well. And you can see that I kind of start in the medial aspect of the lip and work my way more laterally. And I'm always switching sides to kind of get the appropriate angle. Here I'm going in again, kind of perfecting that Cupid's bow, placing a good amount of product right there, always retrograde injection, so I'm never placing a bolus anywhere. And again, using that fanning technique like seen before to kind of spare the patient a poke. You can see the body of her lip really fill up nicely. And then I'm going to come near the oral commissures and place, just a little bit of product. I'm going to taper the amount because of the natural way that the lip tapers. Here I'm moving on to the bottom. She has a beautiful full bottom lip, but we're just going to add just a tiny bit of product there to keep those lips plump throughout the winter. This patient holds on to filler pretty well, but just, of course, wants to kind of be topped off, and they're looking beautiful. Moving to the other side, I like to kind of also fan in the bottom as well because she does have some nice vertical height, so she has a lot of lip there to fill. So sometimes you need a couple struts to really fill the area. Not only is this product going to provide volume, but it's going to also provide hydrating properties. Of course, near the oral commissures is a little bit more pinchy, so you see the patient wince a little bit. Again, she's doing great, and you can see that I'm constantly changing sides. I want to be at a great angle so that I can provide the best possible technique for the patient and achieve the outcome she's looking for. You can watch that tissue fill so nicely. I'm going to go in just slightly more, add a little bit more, and make sure I like the way it looks. All right. My favorite part, I'm kind of observing the lips and making sure that I like the way they look, talking to the patient a little bit, and then I'm going to use a piece of gauze to manipulate the lips and kind of mold them just slightly. This product is very moldable, so that's the nice thing. I can kind of move it to an area where I want it or out of an area that I don't, and it is moldable for some time, but we want to do most of the manipulating right after while she's still numb. So I'm making sure I don't feel any lumps or bumps, nothing crazy, making sure it's kind of consistent, and nothing, is a glaring abnormality within the filler. They're looking beautiful. Just make sure that I get all of the blood off, and then I'm going to apply our post-care kit. So here we are. I have some Comfort Tox lip balm that I'm applying pretty liberally to her lips. That Comfort Tox lip balm is all natural. It has hyaluronic acid, arnica, essential oils, all great healing products that patients love. It looks beautiful, they're nice and shiny, and it's also healthy for the patient. They're not going to put on something dirty or used. It's nice and fresh.
Ooh.
Ooh.
Like a different person.
I know.
Love it.